Did you know that bruising your cervix during sex can be as painful as hitting your knee on a coffee table? Most people don't realize how common this is until it happens to them. If you've ever experienced a sharp, deep pain during or after sex, it could be cervical bruising. But don't panic, it's more common than you think, and it typically heals within a few days. But why does it happen? And more importantly, how can you prevent it? Stick around because in this video, we're diving deep into everything you need to know about cervical bruising. From understanding why it happens to tips on avoiding it, we'll cover all the bases. What exactly is cervical bruising? Let's start with the basics. The cervix is the small, donut-shaped opening at the top of your vaginal canal. It separates your vagina from your uterus, and yes, it can bruise. Bruising occurs when something, like a penis, dildo, or other object, hits it too hard during deep penetration. Positions like doggy style, which allow for deeper penetration, are common culprits. You might be wondering, how do I know if I've bruised my cervix? Well, it's usually accompanied by pain, deep, aching pain. One writer even described it as feeling like she was being poked with a red-hot poker. You may also notice other symptoms, like cramping, abdominal pain, or even spotting. Why does this happen to some people more than others? Not everyone will bruise their cervix during sex. Your unique anatomy plays a huge role here. Did you know that the distance between your vaginal opening and cervix can be anywhere from 3 to 7 inches? This distance can shorten if you aren't fully aroused, making it easier to bruise the cervix. And your cervix can change positions during your menstrual cycle, sometimes sitting lower in the vagina, which increases the risk of bumping it during sex. For some, this change happens during ovulation, when the cervix tilts downward and opens slightly to let sperm in. So, if you've noticed this discomfort peaks at certain times of the month, your cycle might be the reason. Is cervical bruising cause for concern? The good news? In most cases, bruising your cervix is painful, but not dangerous. It typically heals on its own within a day or two. That said, it's not something you want to deal with regularly. Persistent pain could be a sign of an underlying issue, like an infection, or something called a friable cervix, which means your cervix is more sensitive and prone to irritation. If the pain doesn't subside within a week, or if this happens frequently, it might be time to see your gynecologist. They can perform a pelvic exam to check for other conditions that might be contributing to your discomfort. What can you do if it happens? First things first, take it easy. Avoid any penetrative sex or masturbation until the pain goes away. Engaging in these activities too soon could delay healing and make things worse. In the meantime, you can ease your symptoms with some simple home remedies. Take an over-the-counter pain reliever, like ibuprofen or naproxen. Use a heating pad or warm water bottle on your abdomen or lower back to soothe cramping. Wear loose clothing to avoid adding pressure to your abdomen. Try sitting on a cushion if you're experiencing tenderness. Remember, it's just like any other bruise, it needs time to heal. Most people will start feeling better within a few days, and the symptoms usually disappear completely within a week. How can you prevent cervical bruising? No one wants to go through this over and over again. So, how can you prevent it from happening in the first place? The best way is to make sure you're fully aroused before any penetration occurs. When aroused, your vagina stretches, and your cervix is lifted higher, reducing the chance of it being bumped. Foreplay is key here. Spend at least 15 minutes focusing on arousal. If you're with a partner, try stimulating each other's erogenous zones, think the neck, ears, or nipples. Or, if you're flying solo, a good vibrator can work wonders. Using plenty of lube can also help reduce friction and prevent irritation. And when it comes to positions, choose ones where you control the depth. For example, riding your partner or toy allows you to control how deeply and quickly you thrust. Even in positions like doggy style, you can take control by moving at your own pace, while your partner stays still. When to seek medical help? Although most cases resolve without complications, there are times when you should seek medical attention. If the pain is severe, you experience heavy bleeding, or pass large clots during your period, it's time to consult a healthcare provider. And let's not forget, if this happens in the context of forced or non-consensual sex, it's important to reach out for help. The Rape, Abuse and Incest National Network, RAIN, provides support for survivors of sexual assault, and they're available 24/7. Conclusion: cervical bruising isn't fun, but with the right information, it's manageable and preventable. Remember, this isn't something you should have to deal with on a regular basis, and you're not alone. Understanding your body and taking proactive steps, like engaging in proper foreplay, using lubrication, and being mindful of your position, can make a huge difference. If you've had any experiences with cervical bruising, or you're concerned it's happening to you, drop a comment below. Share your thoughts and let's keep this conversation going. Don't forget to subscribe to our channel for more content on sexual health, wellness, and all things that affect your body. Hit the notification bell so you never miss a video.